Hello, everyone. Good afternoon. Thank you for joining us today for Children's Health in Focus. This is a series of featuring conversations with experts on timely health-related topics. My name is Brandy Horton. I serve as Chief of Staff at Children's Health Fund. We started this series of Zoom briefings because the healthcare landscape is complex and constantly evolving. At the same time, it is children living in this country's most vulnerable, excuse me, most under-resourced communities who bear the brunt of so much dysfunction and inequity in the system. Today, we will focus on asthma. And with the support of the board, several foundation partners, and generous philanthropists, we've been able to step up our efforts here at Children's Health Fund to provide services to more children living with asthma than ever before. I also want to take a moment to introduce our three speakers today. First, we have Dr. Arturo Brito, Children's Health Fund's President and CEO. We also have the pleasure of hearing from Dr. Cynthia Cross. She is the Division Chief of Pediatric Hospital Medicine, Le Bonheur Children's Hospital, and that's a CHF National Network partner. She's Medical Director of Le Bonheur on the Move, Associate Professor of Pediatrics at the University of Tennessee Health Science Center. We also are excited to have Jenna Riemenschneider, Director of Policy and Advocacy at Asthma and Allergy Foundation of America, AAFA. Jenna advocates on behalf of over 60 million Americans with asthma and allergies to federal and state lawmakers and officials. And before we jump in, I'd like to cover a few housekeeping items. We would like to ask you all to keep yourself muted throughout the conversation to avoid any background noise. And further along in the conversation, when we get to the Q&A at the end, please send your questions through the chat. And finally, we hope you'll reach out to us after the conversation today if you're interested in learning more about our team and how relentless they are working to ensure the youngest generation has access to the services and supports they need to thrive and succeed. With that, I will hand it over to you, Dr. Brito, for an overview and intro.
Thank you so much, Brandy, and I appreciate you and the guests we have today that I'm going to be asking some questions about their work and how this impacts children around the country. You know, Brandy, it'll be a year, can you believe it, that I will have been here at Children's Health Fund, my current role as President and CEO. But as I said at the first Zoom chat we had a month ago, you know, I'm not new to CHF by any means. I've had a connection with CHF since 1994 when I was the medical director of the South Florida Children's Health Project, one of the now 25 national network partnering programs around the country in Washington, D.C. and Puerto Rico, where, you know, we work together in under-resourced communities, as you said, to provide comprehensive health care to children living in those communities. You know, we believe that all children deserve quality health care, and that's what we do. We deliver it through innovative ways, starting with custom designed mobile medical, mobile dental clinics. We also use telehealth, and we've been using that even before the pandemic. And then the program we talked about last time, our Health and Ready to Learn, is a school-based program that addresses health barriers to learning. And today we're talking about asthma because asthma is something that we see a lot of throughout our national network. As per the Centers for the CDC, for Centers for Disease Control and Prevention, in 2020, there were 6.2 million children and adolescents up to the age of 21 with asthma. That is a significant number. And we know that because this is what we see every day through our programs. What's really concerning for us, because, you know, we really do have always focused on equity. That's what we're about. And is the disparity. Black, Hispanic, and indigenous populations disproportionately suffer the burden of asthma much more than others. And very concerning to us, and I know that Jenna is going to say a little bit more about this, because from their report in 2020, from the Asthma and Allergy Foundation of America report, not only do Black Americans have 1.5 times the rate of asthma as others, they also are 5 times more likely to visit the emergency room because of asthma, and 3 times more likely to die from asthma. So those are things that are concerning, and there's a lot of reasons for that, and I'll let Jenna say a bit more about that in a minute. So right now, I'm going to turn it over to Dr. Cross. As you said, she's the medical director of our Memphis program, Lebanon on the Move. I've known her for a long time. She is native of Memphis, Tennessee, where she practices. She was originally a nurse, and then did that for about 8 years, and went on to get her medical degree, and is now the chief of pediatrics of hospital medicine at the hospital there. So maybe, Cynthia, if you want to say a few words about what you do there and how you relate to Children's Health Fund and how this relationship helps you address asthma.
Absolutely. Thank you. And thanks everybody for joining us today. As Arturo said, I'm a native Memphian. I also grew up with asthma and grew up hoping that I would outgrow it. And then later as an adult found out that was a myth. I can still remember what it felt like as a kid to wake up in the middle of the night and not be able to breathe. What I do here at Lebanon is sort of the end result of not being able to control asthma, and that is that I take care of kids who have an exacerbation that lands them in the hospital. What I do with the mobile unit is cool because it's an attempt to try and keep kids out of the hospital, to keep kids in school, and to keep them feeling better, because there's significant stress associated with having a kid in the hospital, and stress on the kid when they can't breathe. It's very difficult to concentrate if you can't breathe. Some of these kids have restrictions in their activity because their asthma is not well controlled. Their sleep is disturbed. I can remember waking up many nights coughing. So what we do with the help of Children's Health Fund is to get the information to the kids where they are, and to also get that information to their parents, because many times the parents have asthma as well, but they're calling it something else. And so by getting the information to families and giving them the power to control asthma, because it can be controlled, there is no cure, but it can be controlled. And I think that's a very important message and a very hopeful message. I think sometimes our kids just resign themselves to being inactive and short of breath. What's worrisome are the number of kids who die from asthma every year. So this is a really important disorder, and it's kind of off and on. On some days the kids look great, but the threat remains, and giving the families the power to recognize when the asthma is getting out of control and what to do about it can not only improve quality of life, but extend the life of an individual. I have really enjoyed helping these kids through our mobile unit, because our units actually go to the schools, which is cool. And that way the kids don't have to miss school. Many of the kids will be seen on the unit, they get treatment, and they can go back to the classroom. The more time you spend in class, my folks said, the smarter you get. So they didn't let us miss a lot of school growing up. So you don't want your kids' asthma to keep them from missing out at school, not only on their education, but the other fun stuff they can do. Some of our kids who want to be athletes have been restricted because of their asthma. And I always tell them about Jerome Bettis or Jackie Joyner Kersey and how they were world-class athletes with asthma. And I'll stop there. Arturo, I hope that answered your question.
Yeah, I think that a couple points you bring up is that asthma does not have to be a debilitating disease, right? You mentioned some star athletes, and I think it's important though. However, children need access to healthcare that helps them, and working with their families and work with the provider, control that asthma. I remember when I was there last fall, visiting with you and your team, and it just, the team was very emphatic about how this mobile clinic really helps bring healthcare directly into the communities most in need, and how effective that can be at the school or other community sites. So I'm glad you mentioned that, and we're going to come back to that and talk a bit more about how bringing services directly in, especially you as a hospitalist, that understands what happens if you don't do that, then we're seeing a much worse outcome, right? So we'll come back to that, but I want to turn it now to Jenna, Ms. Rimmenschneider, about the Asthma and Allergy Foundation of America, and we're partnering with them to do different things such as this to inform others about asthma. Maybe you say a little bit about yourself and what you do at the organization, but my understanding is that you do a lot of work around environmental impact, or the impact of the environment on asthma, and how that also is a disparity issue. So can you say a little bit about that?
Absolutely. So, AFA is devoted to reducing the burden of disease for those with asthma and allergies. And one of the ways that we do that is through advocacy. And, when we look at, all of the contributing factors to asthma, where you live, where you work, where you go to school, has significant impacts on your asthma. So your physical environment, your living environment. And I think, as we all know, there have been, we have a history of social and structural inequity in this country that has led to, a cycle of poverty, housing instability, a lack of access to healthcare among our, our low income and our communities of color. And so, one of the things that we're really working to do at AFA is, Dr. Brito mentioned the startling statistics about disparities in asthma. Sadly, our 2020 report was actually a follow-up to a report we had done 15 years previously, and those statistics had not changed. And I think I would be remiss if I didn't mention one more statistic, as it is the first day of Hispanic Heritage Month. Puerto Rican Americans actually have the highest rates of asthma than any other racial or ethnic group in the United States. And so, in looking at our report, we didn't want it to be, another description of the issues, which it is. And I encourage you all to check it out. But we also wanted to figure out, if we were to do this report in another 15 years, how are we going to actually see changes in reducing these disparities, making sure our children are able to go to school, be present, be active. And so, we include a whole 69 strategies, but me as the, policy and advocacy director here at AFA, we wanted to include, we have kind of 19 specific policy, strategies that we included, but really, I think that the whole point is that they don't just cover the healthcare sector. We do need to improve access to healthcare. We need to, improve usual sources of care, as, the Children's Health Fund is working to do. But we also need to look at their, having safe and healthy learning environments. So those schools where the kids are learning, are they filled with mold, other asthma triggers? Are they, actually safe to be in? And then, are we looking at their homes? Are there housing, we need to improve housing quality. We need to, combat the environmental injustices of where these communities and schools might be located. They might be next to polluting sources. So we need to really look at air quality. And then, of course, economic stability. Poverty is one of the most significant risk factors for asthma. So how can we break the cycle of poverty? How can we look at policies to help, low-income families accumulate wealth? So there's a number of things that we can do to actually start to make a change, because, here at AFA, we're kind of sick of describing the problem. We really want to start making sure that we improve it.
Yeah, in reading the report, I find the term pollution and equity to be so on point. I was astounded, and I would recommend anyone listening to this, anybody interested in asthma and particularly eliminating those disparities, read this report, because when I see in that report that Black and Hispanic children in this country are 3 to 4 times more likely to have pollution inequity, it really tells us a lot about how we're not addressing this from the preventative end, and how we're not even addressing from the healthcare end, except, for programs like the ones that we support, that we do that. We need to do much more of that, but it'd be a lot easier to address asthma from the pollution and environmental perspective. So those numbers are a little bit astounding and concerning, and so we need to figure out how to do that.
Yeah, and it's also just to mention, I didn't mention climate change, but obviously climate change is disproportionately impacting these same communities and it's increasing air pollution. It's increasing that ground level ozone today, and it will continue to do so in the future. So that is another, systems-wide issue that we need to address.
Right. And short of that, because we know those are longer term solutions, there are things that can be done at the community level to address pollution through advocacy efforts and policy efforts. In the meantime, I want to turn it back to Dr. Cross and ask her, maybe describe a little bit about the kind of what the environment is like in the communities that you take the mobile clinic into, and how asthma is addressed with individual patients in that way. And say a little bit more about that and how your team works with the families to inform, but also to make sure that they have the medication they need to control that asthma.
Absolutely, Arturo. Our mobile unit services rural West Tennessee, and those communities are impoverished. Many times they're multi-generational homes. So you have a child who lives with parents and grandparents, and trying to educate a grandparent on why they can't smoke in the home where their adult child just returned with their child can be sometimes a difficult conversation. But once you point out to the families what smoking does to a child, many of them will reform. They'll start to smoke outside, change their clothes when they come back in. So we discuss those kinds of things with families, and many of us feel that everybody knows some of the information that we provide, but everyone doesn't know the information that we provide. Things about dust control. How can you control dust in your home? Your draperies are a risk, your carpet is a risk, and if you have a choice, opt for a non-carpeted room for your child to use for sleeping. Or their stuffed animals. I mean, we get as detailed as that. Our hospital has a home-based asthma program, and sometimes there'll even be a case manager who can go to the room. And so our folks on the mobile unit will sometimes make a referral to that program if the child lives close enough for that program to help. And then many times when you visit a doctor, you get lots of information, right? And then you go home and you're like, what in the world did they say? And Children's Health Fund is on point with the new asthma guide, the new and improved revised asthma guide. It goes through what asthma is, how it affects the lungs, how the medications work, and what families can do to control it. And it's animated, and the text is very easy to read because we do have literacy challenges in our communities. And it's just a nice way to get the kids involved with their own care, because knowledge is power. And for all of us, our health challenges can be managed if we are given the right tools to manage our health. And so much of our income in this country is directed toward treatment once things go awry. And I really think we do need to pay more attention to prevention. We spend a lot of money on healthcare, and I just really think we get more bang for our buck if we actually invest in prevention. We love our mobile unit, and the families like it when they see that bus roll on into their neighborhood, and the nurses and the school administrators love that bus when it's on their parking lot. I'll tell you a quick story. There was one unit that went to a school, and something happened with the ventilation system. And everyone could smell it, but it was the kids with asthma who had the most trouble. And I think they ended up having 3 ambulances go to that school to transport kids. Thank goodness the unit was there. And if that unit wasn't appreciated before then, they were absolutely revered after that day.
Yeah. Wow. I'm glad you mentioned the asthma guide that's being released today, the newest version. And it's also really important to understand this is an award-winning guide that's Children's Health Fund has been recognized for in partnership with the network it's developed, but it's also done in a way that's both a literacy level that is anyone can understand. I myself, as a pediatrician, I used to use it with the patients because it was easier for me to explain to them how to manage, control their asthma and what to do should there be an exacerbation. So it's a wonderfully designed book by people that are really expert in that area of how to do healthcare education. And I encourage anybody to look at it. I think it was just posted on the chat, the connection to it. It's written in English and Spanish. We have 2 versions, and it's also very culturally sensitive. So with that, I want to ask Brandy if there's, I know we want to save a few minutes for questions from the audience, people listening in. And Brandy, I don't know if
Yes.
there's any questions come in.
There has been a question, and I will love to present it here. The question from the audience is, are there specific cities or geographies where asthma is particularly bad? And wondering how CHF decides where to put their mobile units. So it's a 2-part question.
Yeah, I can tackle the second part. And I don't know if Jenna or Dr. Cross want to talk about the cities or rural areas in this country that are more prevalent. You did mention Puerto Rico, where we do have a program. We have right now 25 programs, as I said, in 15 states, DC and Puerto Rico. Our decision tree for this is a lot of different things, which include need, not just for asthma, for overall global health needs. And we also need to find partners that are, kind of like Dr. Cross and her institution, the Bonner Children's Hospital, that understand the need to provide community care. So it's a complicated formula. We want to do so much more, but of course it's about resources. And our goal right now, we see 100,000 children a year through more than 450,000 visits per year. Our aim is to go over the next few years to 150,000 visits a year. But we need, of course, resources for that. So we're working on that. With that, Jenna or Dr. Cross, do you want to address the issue of the geographic distribution of, asthma?
Sure. So it's actually quite timely. Yesterday, AFA released its 2022 annual asthma capitals report, which ranks the 100 largest cities in the United States based on how challenging it is to live with asthma. So this is based on prevalence. It's also based on ER visits and mortality. Sadly, this year, and Ms. Quinn, I'm so sorry for your loss, and thank you for sharing your story in the chat. Detroit is our #1 most challenging city to live with asthma this year, and it has been for years past. But one of the ways that AFA is working to help address this and others, I will say all of the top 20 except for 1 are on the East Coast. So I think there is a lot of reasons for that, and our report also describes all of the risk factors that may contribute to asthma. But one of the things that we're trying to do here at AFA is we launched a health equity advancement and leadership innovation program where we are trying to look at how to treat asthma where it is in the local community. So in our first year, we have 4 sites, with one of which is Detroit, the other St. Louis, which actually had the highest mortality rate in the United States last year, Chicago, and Los Angeles. And what we're doing is partnering with community-based organizations to try to do these asthma innovations where they include education, support. We're looking at the schools, we're looking at these, and so we hope to continue to do this in the future, because I think, as Dr. Cross and Dr. Brito both know, treating asthma in the community is so vitally important, because it might, the triggers might be different depending on where you live, and so how you address them, and making sure it's culturally competent and health literate. These are all crucial things that we at AFA are trying to work on, but we can't do it alone. So we love working in partnership, as I think many in the asthma community know is vitally important.
Great. Thank you for that information. And one thing I failed to mention about AFA earlier is that it is the oldest and largest not-for-profit organization in the country dedicated to addressing asthma, allergies, and related conditions. So we appreciate your being here today and sharing your expertise. So I don't know if there's other questions, Brandy?
I think that, yes, there is, and I think we have time for one more. The next question from the audience is, have there been any innovations in asthma control or healthcare that you are all excited about?
I'll take a stab at that. I think one exciting thing that we do with the fund is just taking the care to the schools, looking at different delivery methods. The other exciting thing that we do with Children's Health Fund is to look at some of the barriers to why kids don't get care, down to even tackling transportation. So with our mobile unit, our case managers can actually give families gas cards to get to an asthma specialist that's not necessarily in their community, because they tend to be centered in bigger cities. And then controller therapy with an inhaler and a mask for even younger children, so that families don't have to lug around the nebulizer. We're learning that with the right technology, these kids can be managed with an inhaler and a spacer. So that's exciting. And then you've probably heard about all the biologics where they're very difficult to control asthmatic patients, that they can use sometimes once a month. And as an aside, it might help treat your eczema. So things like that, I think, are very exciting. And it's also encouraging to just see the shift toward controlling asthma.
Yeah,
When I was growing up, it was just treating the flare-up or the attack, as they would call it. So those are the things that I'm excited about, and all the research that's going on.
yeah, there's been a lot of advancements in the last decade for sure, in recent years. Biologics is something, and also control of medication. Again, asthma does not have to be a debilitating disease. I think what's important here is that with our national network programs, the reason they're connected to a children's hospital, academic medical center, or a federally qualified health center is because that provides, if needed, access to subspecialty care. If and when needed in a timely way. And that's really important. So you can have all the innovations in the world, but if you don't have access to them, what good does it do? And that's why we're in these communities, to make sure that people have access to the latest innovations.
That's great. Well, thank you for that comment, Arturo. I would love to, looking at the time, take this opportunity to thank you, Cynthia, Dr. Cross, and Jenna, for your time for this really meaningful conversation. Of course, thank you, Arturo. And then thank you all for joining us. I'll close with just saying that we look forward to continuing our conversations in our relationship with the LeBarner Children's Hospital and AAFA, AFA. Hopefully I pronounced that correctly. This work is incredibly important to us at Children's Health Fund, and we are continuously, proactively identifying the most marginalized children living in under-resourced and hard to reach communities. And we partner with the on-the-ground leaders to deliver the healthcare services that they need and deserve. We heard earlier during the conversation about the asthma guide that was released today. I just wanted to take a moment to give special thanks to the Lebanon Green Family Giving Fund for their generous support that made that asthma guide possible. We hope that you all will continue to keep in touch with us and reach out to us if you want to talk about this topic even more and get more involved with this work. And we hope you'll join our next Children's in Focus. And that topic will be gun violence in America, advocating for systems change. And that will be held on Thursday, October 20th at noon. So we hope to see you all then. And thank you again for joining us today. We hope you have a lovely day.
Thanks, everybody. Thanks, Jenna.
Thank you so much.
Dr. Cross, Brandy. Thank you.
Thanks, everybody.
And all our listeners. Appreciate it.